You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Eldercare. For years, I have been helping families, medical providers, doctors, case managers, social workers, nurses find the right solutions for seniors in transition, whether that is after a hospital stay, a rehabilitation stay, or when the care needs at home have changed. We assist in finding the right care options. I started this work because I saw how overwhelming and confusing the elder care process can be. And I wanted to be a guide and a resource for both families and professionals. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet with our families at bedside. We create a customized care plan when someone is needing assistance with bathing, dressing, toileting, mobility. We provide them with options such as residential care homes, assisted living communities, memory care communities. We advocate, guide, and educate throughout the entire process that we work of us working with a family. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Welcome back to Navigating Elder Care. I am your host, Laura Daniels, and in today's episode, we're going to discuss therapy, and I have the honor of having Miss Tiffany Gold, founder of Rise Up Rehab, a leader in-home and community-based rehabilitation. For over 20 years of experience, Tiffany has been helping seniors regain strength, mobility, and independence. Tiffany, welcome to Navigating Elder Care.
Thank you, Laura.
Tiffany, thank you for being here. For those who do not understand, I want you to share a little bit about who you are and how Rise Up Rehab, your therapy company, began.
So my name is Tiffany Gold, and I was born and raised in San Antonio. And after many long hours of volunteer work throughout my young life and college years, that is where I determined and found my passion and love for therapy. I went to occupational therapy school at the University of Texas Medical Branch in Galveston, followed by obtaining my graduate degree at Trinity University in healthcare administration, because I did know the plan was to do therapy with geriatrics and eventually own my own company.
Tiffany, what inspired you to start your own therapy practice instead of working in a traditional setting like a rehab or a hospital? What was your inspiration?
So most of my career was in a long-term care setting called a skilled nursing facility, which I did love and adore, and learned most of my management techniques and how to get great outcomes. And I was there for 16 years. And then I felt like I could make a bigger impact on patients' lives if I served them in their homes. So that's where I came up with the idea of opening my own company, named it Rise Up Rehab with the assistance of my husband. And that is when I decided to offer our services in other long-term care facilities and also in patients' homes.
Where does Rise Up Rehab, you kind of answered that already, but where do you see your patients, Tiffany? Where does your therapy company, Rise Up Rehab, see their patients?
So Rise Up Rehab offers geriatric physical therapy, occupational therapy, and speech therapy in a variety of settings. The first one and the main one being assisted living and independent living. Those are facilities that geriatrics live at long-term. They are usually upscale senior living communities. And we also see them in our outpatient therapy clinics. So those patients can come from home and come to our clinics to get the services. And we also see them in their homes, so people that still live at home in houses in the community. So we essentially will come to you wherever you live.
What do you think families misunderstand the most about physical therapy, occupational therapy, and speech therapy, Tiffany?
So there is a misunderstanding often with families as far as how one can qualify for outpatient services. So the main qualification is there must be a change in condition. And something like that would be a hospitalization, an illness, a surgery, but something that has made their health and physical abilities decline. And that leads to needing a physician's order. A physician's order drives the therapy, and it is also required by most payers and insurance companies.
So as I work in the community, that seems overwhelming for families, right? How do I get an order? How do I do that to start either physical therapy, occupational therapy, speech, or all three disciplines? How do you help with that and facilitate that?
So we do have a comprehensive intake office, and we will assist families with obtaining that physician's order, whether it's from their specialist or from the primary care physician or from the institution that they are coming from, such as a hospital or skilled nursing facility. So we take all of that pressure and responsibility off of the family, and we do obtain that order and make sure that we use appropriate codes and terminology so that it is covered by insurance.
Tiffany, can you briefly explain how each discipline, and I want you to give me an example of how physical therapy, occupational therapy, and speech, how does that benefit an adult, a patient?
So what I hear you asking is to describe the difference between all therapies, and that's a very common question I get with families because they don't understand what the difference is and what each discipline does and provides. So physical therapy helps with improving someone's overall strength. So strengthening and getting stronger, and also helps them with their functional mobility. So for an example, if a patient has a stroke and they used to be ambulatory, physical therapy would help with getting them walking again, improving their balance, and getting them to be able to function more independently around their home and living environment. Occupational therapy focuses on becoming more independent with self-care tasks, which we call activities of daily living. And those consist of things like dressing, grooming, toileting, bathing, making our bed, so everything that we do every day. And a lot of times people think, oh no, mom just needs physical therapy because she needs to walk again. Well, if you have a stroke and you are paralyzed on one side, which is called hemiparesis, that means you can't use your hand to brush your hair or to brush your teeth or to pull your pants down to go to the restroom. So that is where occupational therapy can come in and rehabilitate those areas. And then finally, there's speech therapy. And speech therapy is very misleading because people think, oh, mom doesn't have a speech problem, she doesn't need speech. Well, speech covers 3 different deficits. The first one being speech, so any issues or disorders with communication, word finding, articulation, processing, putting sentences together. The second area is cognition, so any impairments with memory, with recall, with short-term memory, long-term memory, any kind of cognitive deficits. And the third area that speech therapy covers is swallowing. So any difficulties with swallowing, and that area is often seen with stroke patients where their inability to swallow means that they have to be on an altered diet and be taught aspiration precautions so that they don't aspirate.
Tiffany, as you know, I'm in assisted living communities all of the time and memory care communities, and I see the outcomes and all the positive changes that rise up in your team, the impact that you have on these families. I want you to share a moment when you saw therapy truly change a patient's quality of life.
So I could go on and on about the miracle stories that I witness every day, but I do have 2 specific ones that stick out. And the first one being an older gentleman in his late 60s to early 70s, and Mr. Smith was a practicing architect who owned an architect firm here in San Antonio, and he unfortunately had a brain aneurysm. And his brain aneurysm didn't really affect his physical abilities, but did affect his cognition. So this was very detrimental to him. he did almost lose his life in the emergency room, but was saved miraculously, and needed extensive speech therapy for his cognition. His goal was to return to work full time, to continue his practice and keep serving his clients. And that was a huge expectation that we didn't think maybe would be realistic after his evaluations. But with consistent work and completing homework after we gave it to him after every session, he was able to return to work. A lot of that was, his motivation and his support from his family, but that was really, really awesome to see. We did have the therapist return to work with him a couple of days to see exactly what an hour or two of work entailed, and we brought work back with him to therapy, having him complete drawings and respond to emails and return phone calls, and he was able to return to work. He returned to work part-time by choice, but he was very, very excited.
And there's also a lot of education that you provide patients once they discharge, correct, to continue the therapy and continue improving at home in a setting.
Yes, we do make sure to, from the get-go, know what their discharge plan is, to see what we're working toward. And we also include home exercise programs during every session so that they have things to work on during therapy, like when they're with us during therapy, but at home, and then also to follow through with those tasks and assignments after discharge so that they can maintain what they've gained in therapy.
Tiffany, we know that Rise Up Rehab is in so many of the communities around San Antonio and around Texas, specifically independent living communities, assisted living communities, memory care. How does therapy fit into those environments?
So I would advise you that if you are looking for a placement for your loved one and are using a placement coordinator such as Laura, use a placement coordinator that knows the facilities that do provide therapy in-house. And there are a lot of benefits for therapy to be in-house, such as keeping them as independent as possible throughout their life. They're all geriatrics, and they're all going to be declining at some point. So having that therapy service in-house, on-site, 5 to 7 days a week is a very big, crucial part of the aging process. Another benefit is that if a patient or a resident does live in a long-term care facility and they're hospitalized, they are able to return to the assisted living facility to receive their therapy rather than staying in an acute care hospital getting therapy there, or going to a skilled nursing facility where they wouldn't really get very much therapy. But coming back to their assisted living, coming back to their room, coming back to their living environment is a huge plus and does help them recover faster.
Tiffany, how do you collaborate in these communities and these assisted living communities that you are in, independent living and memory care? How do you collaborate with caregivers, nurses, and families in order to support the patient as a whole?
So our multidisciplinary collaboration starts from the get-go. After we receive a referral for therapy, we contact the family to introduce Rise Up Rehab and explain that we have orders or are getting orders for their loved one to participate in therapy, and make sure that they're on board and make sure that we have consent and they understand the reason why we're seeing their loved one. So from the get-go, the family is involved immediately. Then we make sure that the caregivers and the facility that the patient resides at is aware that they will be picked up on therapy and the reason why, if they don't already know. A lot of our referrals do come directly from the facilities, so they're already involved and they know why we're picking them up. And then at each facility that we are in, we have a director of rehab, and that director of rehab is tasked with attending the morning management meetings with the assisted living staff and their managers. So we make sure that we integrate with their management team to be on the same page and receive the same updates on any resident changes, resident admissions, and report progress in therapy on the residents that we have on caseload. And finally, we just in general make sure that we are present at the facilities and involved, and make sure that we have a multidisciplinary communication involvement, and are in touch with the family on a frequent basis to communicate how therapy is going.
Tiffany, let's talk a little bit about your therapy and how that compares to in-home therapy. So when a patient is in the hospital and they're discharging back to their assisted living, for example, how is having a therapy team and your services in that assisted living different from them getting in-home home health? How are you different from that?
That's a great question. So home health, the main difference between home health and Rise Up is Rise Up Rehab only provides therapy, and home health provides skilled nursing and therapy. However, during a home health episode, the amount of therapy that a patient gets is significantly less than what outpatient therapy can get. So Rise Up Rehab is outpatient therapy, and we do not have limitations on the number of visits that we can provide to a patient, as long as it is medically necessary and they are showing progress and consistent progress, we can continue seeing them. So I would say that the main difference is the nursing service, and many people don't need the nursing component, or it may just be something as minor as being able to check their vital signs on a regular basis, and that specific task does not require a nurse. That's something that the therapist actually do during each visit. So because we can be in their home environment more frequently than skilled nursing or than home health can be, I do feel outpatient therapy is more beneficial. And a lot of rehab hospitals and inpatient hospitals are moving toward referring their patients to outpatient therapy in the home because of this. They get more care, more attention, and are seen more frequently and have better outcomes because of it.
So when we talk about, it's not outpatient, them going out. Outpatient therapy is in the building, in their assisted living community, memory care community, or independent living.
Yes, it is very misleading. We are licensed as an outpatient therapy company by Medicare. However, we do see people in their homes. We are mobile, and we come to you. So in the facilities, we are stationary, meaning we have a physical gym in the building and a full-time therapy team present in the building. But we can also go to patients in their home.
One of the biggest differences I see with your service is that if they go to the patient, they're ready for therapy at 10 a.m., that is scheduled, and they're not feeling well, or they don't feel like doing it for whatever reason, you can come back and make up that therapy session after lunch or a few hours later, versus having home health, a physical therapist coming from the outside, walking into assisted living, seeing Miss Jones, and Miss Jones, she's not feeling well or she's in pain, they're going to have to reschedule that visit for a later time. So that is a missed visit.
Yes.
Most of the time.
Yes, most definitely. So we do have the benefit of being in the building all day. So we do have a 3 refusal rule in my company, which means if a therapist goes to treat a patient and they're not feeling well, or they're out of the building at that hour, we have to go back and make 3 attempts that same day. And this is a very common question that I get from families, because some of these geriatric patients don't feel like doing therapy, and they do want to refuse a lot, and they don't want to do exercise because it hurts or it's tiring. And so that is something that I take very great pride in, and that most of my therapists have geriatric experience, and they know how to work with them, and they know how to make them succeed.
And it's all in the approach, and I've seen your therapists do that with such love and respect and patience, right?
Yes.
It's all in the approach. Tiffany, if a family is listening now and is overwhelmed, what would you want them to know?
So I would want the family to know that Rise Up Rehab is the service line for hope. And we will do everything in our power to improve their loved one's function, improve their loved one's ability to communicate, and their ability to recall and improve their cognition. And we sincerely take what we do to heart. And all of my therapists are interviewed by me and hired by me and no one else. And so I am very specific and mindful of the therapist that I do hire, because I do have a motto that I treat every patient as if they were my parent.
Tiffany, where can families learn more about you, about Rise Up Rehab and your entire therapy team and the services that you provide?
So I welcome you to visit us at riseuprehab.llc.com. You can also visit us on Facebook, or you can call us at 210-572-4954.
Tiffany, I want you to share with us that one moment or one story or a few stories of why you do what you do with such love and passion. And I have the honor of watching you do this almost, God, a few times a week. And I'm in awe of you and your therapy team and your passion and dedication for therapy. Can you tell us that one story or stories?
Yes. So I'm sure that you recall a lovely lady named Miss Mitchell, who you brought to one of our communities. And she admitted to one of our communities about 3 years ago because she had a stroke. And she was completely independent. She lived alone. And the main thing that she suffered from due to the stroke was she became completely blind. And no, that wasn't a physical disability, but it changed her entire life in every way. And we have been treating her for 3 years in the facility. And after 3 years, she reached her ultimate goal and moved back home. And she is living completely independently, alone. She does not have anyone living with her. And she is able to function on her own in every way. And I would say that her commitment, of course, and her drive and motivation and passion did get her to where she was. But it also was all of the work that the therapist did to help her. And that is a true testimony to why Outpatient is successful. I also have a patient named Mr. Jones, and he came to one of our facilities after acquiring a horrible pressure wound on the back of his leg. And when he came to us, he ended up having to have his leg completely amputated. And this is a man that had just retired. He was an investment banker, full of life. And what he loved doing best is going to his ranch to hunt and fish. And after 3.5 years of therapy and getting him almost back to where he was, he is now able to visit his ranch on the weekends and do what he loves. And there's nothing more rewarding than seeing someone meet those goals that you think are impossible. But with therapy and with licensed therapists that have the geriatric experience and the true passion and love for what they do every day, all day long, that is what inspires me and drives my passion for what I do.
Thank you. I thank you for being here. And for those families and listeners who want to know more about therapy, can you share your number again, Tiffany?
Yes, 210-572-4954.
Thank you for joining me on Navigating Eldercare, where we bring guidance and answers for every step of the elder care journey. If you are a family member, hospital case manager, or healthcare provider, and you know someone facing a change in health or planning for future care needs, Care Advocates is here to help you find the right care at the right time. Our commitment is simple: care, compassion, lifetime support. For a free consultation, call me at 210-669-2222. Be sure to subscribe, like, and share this podcast. You can listen to us on past episodes on YouTube or listen on your favorite podcast application. You can also listen to us here every Sunday at 8:30 on 9:30 a.m. The Answer. I am Laura Daniels, and this has been Navigating Elder Care, helping you find the right care at the right time for people that matter the most. I thank you for listening.
This has been Navigating Elder Care with Laura Daniels, providing guidance and answers for every step of the elder care journey. For a free consultation, call 210-669-2222 or email laura@advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com. When a loved one needs care, the decisions can be overwhelming. Laura Daniels, founder of Care Advocates, helps families and medical providers find the right elder care solutions, from hospital discharge to assisted living and beyond. She's your trusted resource for smooth, stress-free transitions. Join her each week for Navigating Elder Care, Sundays at 8:30 a.m. right here, where she shares expert advice, real-life solutions, and interviews with professionals who care. Need help now? Call 210-669-2222 or visit advocatern.com.